and also to be more intentional in terms of bringing forward solutions. Most notably, in this case, I would say solutions structured around but not limited to addressing social determinants of health. Information, again, data that underscores the importance of this, data that's been shared by the likes of Kaiser Permanente, where they identify Black and Brown, specifically Black and Hispanic communities, being the communities where the greatest demand for solution and need for solutions as they pertain to social determinants of health happen to be within Black and Hispanic communities. So we have this tremendous opportunity to transform healthcare by taking an honest look, taking bolder steps as they pertain to addressing root cause issues in the areas of inequities in healthcare within Black communities. So this leads us to the conversation and question with my colleagues, Laquita and Arthur, in the areas of their focus and expertise. Laquita, I'd like to start with you, if that's okay. Laquita, your area of expertise is in housing, which happens to be among the social determinants of health factors. Perhaps you can share with the audience, if you would share with the audience, your perspective on this. I think that it'll give us an opportunity to further conversation as well as begin to further educate our audience on the importance of housing and its relationship to social determinants of health.
Absolutely, absolutely. Thank you, John. And thank you for the warm welcome. When I think about housing and the work that Smaltmore Homes is doing, really it's creating sustainable communities because it doesn't just start or end with housing. We have to think about the community assets. Are there businesses there? Is there a grocery store there? And all of that matters because if I can't get to those assets in my community, then now that's taking time out of my life to make it so that I can get to those things. And then if they're not in, reasonable distance, or I don't have a vehicle, that is actually creating trauma and stress. So for me, that's how you think about it when we're just thinking about whole communities. But for Smaltmore Homes, like, housing is everything. I'm working with folks who live in camping tents in Baltimore City.
Mm.
That to me is outrageous, and that part should be illegal. Like, not being unhoused is illegal. You cannot sleep in public. You do not have any worldly I don't know. You don't have any agency for, because you don't own anything. And so that becomes a problem. And so for me, I think about when I'm talking to somebody about housing, I also have to think about they're probably hungry. So I can't talk to you about housing if you're hungry. I also can't talk to you about housing if you don't have a job or a skill set that's going to keep you gainfully employed to pay the bills to keep the house. So it's like you said, John, it's definitely social determinants of health. We can't look at it in this siloed way that capitalism wants us to believe, that we can solve problems that way. And maybe there are some places where those problems can be solved, but in our communities, it needs to be holistic. We need to think about, like you said, the healthcare of it all. Johns Hopkins is right here in the hood, but also they've done harm. Everyone has heard of Henrietta Lacks. So there has to be some sort of ability to rebuild these relationships, to create and foster strong relationships that create better environments for our communities. It starts with housing because what the trauma that you have to endure when you don't know where you're sleeping every night is something that we can't imagine because we have somewhere to sleep every night, right? But when you're thinking about that, like, that is trauma inducing. That is not something that anyone should have to deal with, especially not children. And there are 3,000 folks who sleep on the street every night in Baltimore City. So, one way or another, specific to Baltimore, Housing is everything. It's not the only thing, but it's everything. And all the things matter because we are whole people. We're not individuals that are siloed or sliced and can be compartmentalized. It's not healthy that way.
Well, that's fascinating and wonderful how you make the connection, not only from the standpoint of, if I'm hearing you correctly, the temporary housing need, but also looking at, what paths can be created to create ownership as well, building out the assets within the community. It's interesting, there was an article that was released not long ago that was a collaborative, if you would, with Brookington Institution or Brookings Institution and the NAACP, where they identify the importance of home ownership and what that could mean for an individual's future. Not only from the standpoint, naturally, of having a means to building wealth, but also having a means to extending one's life expectancy. So, when we talk about housing and what that means in Black and Brown communities and translates, it's far more than just having a roof over your head. It goes a very, very long way. So, I commend you for bringing, that into the conversation. I'd be curious, to hear from you, your thoughts and opinion in terms of when you think about root cause issues that lead to, the plight of homelessness, a housing insecurity, notwithstanding those things that come following that or before that in some instances, i.e. food and transportation insecurities. What are your thoughts on some of the root cause issues in those areas?
Oh my goodness. I would, being in housing, I would start with redlining. Like redlining has set the foundation back in 1930 something and is still ripping its ugly little head through our communities and doing what it was supposed to do. We're not being funded. There's an appraisal gap. There are blighted communities and vacant houses, and all of this is specific to redlining. I mean, and if we think about that, then that is the structural racism that looked at a map and said, Black folks live here, immigrants live here, folks who are not white live here, and now they deserve less than others. And it's been perpetuated. We see it in our school systems, we see it in our roads, we see it in our communities. And, quite frankly, I think it's racism at its root, but specifically the redlining and the perpetuate and the supporting the fact that we are not going to invest in these neighborhoods, and it's harder to get a loan for folks. And if you live next to a vacant or blighted home, your insurance is probably nullified. And how do you build wealth that way? And who's going to want to buy that home? So all of these things to me tie right back to redlining, some rules that were made almost 100 years ago, and we still haven't figured out how to undo it. Because the system isn't broken, it's doing what it's expected to do. And so, unless we actively get involved to break that cog or get the wheel reversing the other way, it's just going to keep on churning and chewing us up and doing what it needs to do because capitalism is always going to win over people. And so, those profits, it's the profit mongering of it all. But redlining, read The Black Butterfly. Dr. Lawrence Brown, brilliant book, but yes, I would start with redlining. Maybe even Not in My Backyard Not in My Neighborhood is a great book as well, but it's the redlining to me, John.
Yeah, excellent, excellent. Capitalism, it definitely has its challenges, but it also has its opportunities for Black and Brown communities. And I always go back to when I was growing up, my family would play a lot of our old R&B, James Brown, and there was just one song. I mean, I didn't get it then, but as I grew older and I settled into my career path, it made sense. And the lyrics went on to say, I don't need anyone to give me anything, just open the door and I can get it myself. And that's the challenge. There's just too many, doors that have been closed and not opened up from the standpoint of an equitable opportunity for folks to really make a difference in their own lives and become, self-sustaining, if you would.
Yeah, I
So,
mean, but
yeah,
also I think it's the idea of people recognizing that they have agency and
yes,
not asking for permission, but asking for forgiveness. I've gotten way further that in my life that way because folks will tell you how hard something is before they'll tell you how they can help you. And it's
mm,
like, that's not what I came to you for. I already knew it was hard. I knew it was hard when I thought about it. Otherwise, somebody would have already been doing it. Like, I get that, but how can you help me? And
mm,
so it's the idea of you having agency, you having the capacity, and also then being able to implement and have a supportive system. So continuing to have conversations like this, I think, is what we need to do so that, neighborhoods and communities can move forward so we know what resources are out
yeah.
there for us.
I think that's exactly where we need to be. We need to be talking about it, and as they say, also committed to walking the talk. Just taking a step back, you had referenced John Hopkins. I again, after having an opportunity to read a collaborative study that they put together in conjunction with the University of Maryland some years ago, I believe it was in 2009 that it was released. And what it was is the economic burden of healthcare inequity. And for me, it was mind blowing because at that time, I didn't or was not making that connection between economics and healthcare inequity. Again, paraphrased, that collaboration, that study had revealed that over a period of 4 years, there was a cost associated with it, a cost associated with healthcare inequity. And I believe it was somewhere in the neighborhood of $200 million per annual over a 4 year period. And over that same period of time, when you extrapolate that over the economy, it represented 1.24, $1.25 trillion. So, I mean, that is a lot of money. So just imagine if in some way, we could find a way forward to really address the issue of healthcare inequity, which is linked to, as you shared, housing insecurity, transportation insecurity, food insecurity, et cetera. And although these are downstream issues that manifest because we're not doing enough upstream, again, the opportunity, to create transformation in a sustainable way, it's just profound. So, we have the knowledge and understanding of here's the issue, but we also have the realization and knowledge that, okay, these economics, if we put it in the right place, we can create transformation that could be remarkable for so many folks and for generations to come. But with that said, wanted to bring Arthur also into the conversation. Arthur has been doing some tremendous work as it pertains to diabetes and amputees and working with that population. And, so why is this important? When we talk about, the comorbidities that exist, throughout the United States and a disproportion um, of those comorbidities as they relate to Black and Brown communities, this becomes a very relevant topic for this conversation. So Arthur, I'd like to start with your experience. You've been in this space for a while. You've had an opportunity to gain and garner perspective from, both sides of the aisle, if you would. If you could start with sharing your perspective on, the issue of health disparity and inequity as it pertains to diabetics and some of the challenges, that they're faced with limb amputee, et cetera. That would be great.
Sure. Thank you, John. I actually would echo what Keita said earlier about holistic solutions. I think that's the heart of why we have such a large diabetic limb issue within the BIPOC communities and also other communities that are poor. Is because we don't look at it very holistically. We look at in the wound care world, we look at the hole in the patient, not the whole patient, as they call it. So that's a very important part because most people that have diabetic limb, it starts a lot of things starts upstream as it relates to social determinants of health, proper nutrition, access to clean, good food and clean water, access to housing, and a lot of other economic issues have to be addressed, not just putting a $5,000 skin graft on the patient over and over again, where the doctor and the health system makes money off of that. But we need to actually address the root cause. So I think we're at a pivotal point now because of the social determinants of health that we can actually, as people of color, BIPOC people, address the issue where we can push policies that are already built on the social determinants of health to bring more holistic care to the market. Look at things like hospital at home, where you can get more convenient care being done at your home and just alleviate some of the burdens of transporting somebody to a acute care center or wound care center. Looking at using technologies like AI and even virtual reality, different technologies that are out there right now. We need to push those uses into our communities affordably so that we can bridge the gap and have solutions that can, impact us now. I think a lot of times there's a disconnect too between the world of social impact or the nonprofit world and maybe clinical practice, and kind of bridging that gap so we understand both sides. There is a understanding of clinical disease state is very important that sometimes people in the social impact side don't understand. And there's a side of social impact and community-based care that the people in clinical practice don't understand. I think bridging those gaps and having holistic solutions that looks at both sides in a more comprehensive, consultative, or collaborative approach to treating somebody's health, especially in the diabetic limb world, could be a big thing. And I really think Baltimore is a place that can happen, in Baltimore and other BIPOC cities.
Well, that's great. And, your point really resonates in terms of, making a distinction between, providing a therapy, if you would, to address the hole that might be in a patient or over the wound versus treating the whole patient. It really resonates because when you think about even social determinants of health, again, those areas of food, transportation, housing, which again are a manifestation of what happens downstream because we're not doing enough upstream, i.e. education, which happens to be a neglected social determinants of health, economic empowerment and or addressing economic factors, which happen to be neglected areas of social determinants of health. So, it's very interesting how, there's suddenly this heightened effort, though still through a lens of philanthropic dollars, unfortunately, to provide funding for social determinants of health. In essence, it is very much like providing a Band-Aid. Yeah. Because if we're not addressing the upstream, we are allowing that wound to fester and to grow and to become a greater economic burden, notwithstanding its impact on the lives of human beings. Yep. And again, going back to a point that I made earlier, and before I do that, I want to apologize. I did not use Vernelia's last name properly. It's actually Vernelia Randolph, not Rudolph, so I apologize for that. But again, if we're not addressing this more holistically, not just honing in on, the importance of the downstream challenges of housing and food and security and transportation, very important. We have to do these things, but it's equally as important that we chew gum and walk at the same time and begin to invest in these upstream areas where we can create transformation that is sustainable. So again, your point really resonates. What we're doing now is we're placing a Band-Aid on a stage 4 wound, and we're expecting that stage 4 wound to heal when we haven't really properly invested in terms of what's needed to really be impactful in that way. With that, I'd like to pivot back to Laquita, if I could. Laquita, getting back to that housing conversation, what are some of the things that you think could be done better from the standpoint of educating and empowering individuals to understand the role that they themselves play in their future and what they should be doing, whether it's, through financial literacy, et cetera? What are some of your thoughts there?
So again, I have to speak in the context of my experience. With Baltimore Homes, we host an intergenerational healthy housing workshop. It covers tools to clean your water and to lessen your laundry, but it also covers a family business plan to think about rehabbing a Baltimore multi-unit and what it would look like for grandma to age in place, for the grandkids to know how to fix the door and replace the screens and all the things, like just thinking of it from A to Z. So for me, when families come to these workshops, we're giving them financial literacy, we're introducing them to a banking person, and I speak about the ideas of investing, but that's just an idea because really what I need you to do now is know your budget, know that you have passive income that you can invest. And once you have that passive income, now you become an investor. But first, we have to get our foundation straight. We don't have healthy relationships with money. So that's something we have to address. We don't often understand the way that some credit works. And sometimes that's intentional, right? Like there's more convenience stores and places for me to cash my check than an actual bank. So knowing that, finding out that a bank has free service if you deposit a check every month sometimes blows people's mind. But I've had a bank account since I was in elementary school. So understanding that these gaps exist and that people just don't know everything.
Mhm.
And really, it for me, it's the education of it all. Like, so if you don't need the financial education, you don't need the financial literacy, maybe you can go on to those investing classes. If the investing classes are a little too much, maybe we need to understand our relationship with money. If that's not what we need to do, maybe we just need to open a bank account with one of the partner banks in Baltimore City that doesn't charge, a monthly fee. Or maybe it's just understanding that there are a slew of people from different backgrounds that need various levels of education, and just filling in little gaps can maybe spark or inspire a thought for betterment. And having these conversations as a family with the children in the room, speaking of the bad credit and understanding that I got started with this because when I graduated from Spelman, girls were being gifted houses to the cities that they got their jobs in. That to me blew my mind. My parents hadn't owned a home then, and I didn't have a job in another state fresh out of graduation. So everything about that was like, well, what kind of world are y'all living in? But it's the relationships. It's that their parents already had that understanding of generational wealth and they understood that that house is going to be a foundation for wealth because you got to pay rent and you got to live somewhere every month, every day, B. So if you know where you're going to live and you can lock in that rate because you're a homeowner, but then also think on the other side, I can't call my maintenance guy. So I need to put aside 10% so that when this AC go up, I'm going to still be cool in the summertime. Okay. Because that will be a burden. And instead of it being a burden, I'm planning in my budget to save to maintain my house and plan for the emergencies, but also the rainy days and also the COVID days. We have to have multiple bank accounts. It's not just a savings account. There's a savings, there's an emergency fund, there's a rainy day fund. And using these tools so that when we're in a stressful situation, we have agency to make choices about what we're doing. We're not just going with the easy route. We're not just going with what somebody throws at us. No, we have time to think about it because money solves a lot of problems. And sometimes it's just a little bit of money before the problem has snowballed, right? And so it's understanding that 1 + 1 is 2. And if we can do that every week, by the end of the year, we'll have over $100 and just keep it going. And again, starting with the babies. So babies need to understand how to change light bulbs and change the air filter and switch out the screen, but then also understand the more important things so that they are confident and comfortable with working in their home and changing things around. So as a maker and as a builder, teaching people tool safety, just to safely use tools in your home, gives people so much agency and like, oh my God, I can't believe I know how to use a power tool. And it's like, okay, well, if you like it, I love it, but come back and help volunteer, right? Because we need to keep building
Right.
these micro shelters. So it's the whole idea of, again, being holistic, thinking about the financial wellness, the skill sets of it all, building the education, building the confidence, and creating the space where people can just thrive.
Mm, excellent. You know, it's interesting, you know, in the world of social determinants of health and healthcare, you know, there's, you know, this phrase of connecting the dots, even though they're not all being connected as they should be. Folks are starting to connect the dots. I'm curious, Arthur, from your perspective, when you think about, you know, some of the challenges that exist with homelessness, what are your thoughts in terms of the correlation between homelessness and diabetes complications that ultimately lead to amputees, et cetera? What are some of your thoughts there?
Well, that's actually an interesting question because there's actually a very big problem with diabetes and diabetic limb with the homeless population, especially homeless populations, people that use certain drugs. Trank, for example, there's a acceleration in loss of limb, and you see people's limb being enlarged, for example. But there's resources that are being deployed, but as you know, just because of the lack of certain tools and resources in the community, we haven't had as much resources for homeless population of people and mental health services for people that are homeless as we need. So it's a very difficult situation. I think what will bridge the gap is something that could be more convenient. It's just being creative of as far as getting them access to solutions in a different way than the system that we have right now. Most times we rely on having a detailed database of where a person lives and who they are. A homeless person won't have that situation. They're going through a lot of different emotional issues, and maybe drugs could be a big part of that, and also other things could be a part of that, mental health. So I think being flexible, using our like community-based organizations, churches, and other organizations to be creative and using the ER emergency room in a different way when we see a patient come in that maybe is in there because they're homeless, and addressing them in a different way, not just putting a band-aid on them and treating their wounds, but maybe treating their deeper wounds, which is asking them questions about what's going on, how can we address the issues you're having, and kind of get them deployed to the right community-based organization or help that can help address those issues.
You know, that's profound, Art. You know, thank you for sharing that. You know, it actually brings to mind, you know, I read not long ago, there was um, a position paper, if you would, that was put together by a fellow at Harvard University. And what they did is they took a look at social determinants of health, and, you know, they analyzed, you know, the participants, you know, that were engaged in these various SDOH platforms, et cetera, and even to some extent, community-based organizations. And what they had discerned, or what this individual had discerned, and it really did strike a chord, you know, for quite a few folks in the industry, that somewhere in the neighborhood of 10 to 15, only 10 to 15% of participants felt as though their needs were being met. Whereas we now have potentially 90% that are not. So that suggests to me that not all of the dots are being connected. It suggests to me that, it doesn't take away from the value of addressing social determinants of health, but we really do have to rethink how we're going about the screening process. It's interesting, you know, I have my primary care provider. Yeah, I do my regular physical exams. And, you know, in the last few years, I've noticed an additional piece of paper that's put in front of me, you know, and it's like, you know, basically ask me about social determinants of health. But it's particularly, for the most part, housing, transportation, utilities, those types of things. And, you know, these are very personal questions to ask someone. And if you don't know them and you don't have an intimate relationship with them, there's going to be some reluctance in terms of handing over this information, notwithstanding the historical distrust that exists within Black and Brown communities. And we all know about that. So we have to start looking at this a different way. You know, one of the things that, you know, I think about, you know, in businesses, industries outside of healthcare, you know, there's this phrase of customer intimacy, meaning, you can never get too close to your customer. And that model, there's a place for that in healthcare. I think we can do better in terms of creating a greater intimacy between the clinician and the patient. And this is not to take anything away from the clinicians, because they are up against it. Our hospitals and health systems and nurses and doctors who valiantly, commit to the good fight every day, they have some systemic challenges they have to deal with, their environment, their social determinants of health, they're enduring stress and trauma as it pertains to emotional exhaustion. But we really do have to sit down and start having some more courageous conversations about social determinants of health. Not so much I'm screening, I'm addressing, and I'm so-called closing the loop, but I'm getting to know that patient better. I'm taking a more intentional step forward into their community to understand where they're coming from. But there's an opportunity to do more there. So Art, really would like to talk to you more about some of the other work that you might be doing as it pertains to addressing health equity. I'm fortunate to have met you in my journey, but there's other things that you're doing as well. Maybe you can expound on that in terms of how it touches into the healthcare inequity piece.
Well, John, I mean, really what I'm trying to do is really connect the dots. Honestly, that's what I'm doing. I'm working with you. I'm working with, Keita, and working with different people, obviously, in DCC and different organizations. But to me, it's hard to put in one box. But I think it's connecting the dots. We're working on projects right now, hopefully with the state of Maryland and the city of Baltimore, to address diabetic limb. Looking at a pilot that can really address it using some technology, especially the AI technology that's been developed out of Baltimore, out of the area, that can help make the evaluation of wounds patients have more easier, and then link that to a comprehensive, holistic way of addressing the issue, not just the way that it's done now per se, and kind of change the paradigm of how diabetic limbs are treated and are evaluated on a regular basis. And then also just looking at the big thing of reversing redlining. And like what Keita said earlier about Dr. Lawrence Brown, I mean, researcher in person that's really done for the community. And we really need to address the underlying issues that was started in Baltimore with redlining that went everywhere else, and showing how we can reverse that and solve the problem in Baltimore as it relates to housing security or livable housing, livable communities, looking at, tiny homes intelligently within the city, looking at different things that can be creative to address the issue that we have. I think it's very important. I think that's what I'm working on, is really looking at projects around housing security and really affecting the urbanization of BIPOC communities, and looking at really addressing the diabetic limb issue and having a comprehensive, intelligent, holistic method of fixing the problem, not just putting a Band-Aid on it like we've been doing for a long period of time.
Excellent.
Yes.
There's some more I wanted to discuss and questions to share, but I just wanted to remind those that are in the audience, if you have any questions, we are going to be saving some time towards the end to address your questions. So please feel free to put those questions in the chat box, and we will do our utmost to get to as many of them as we can. One of the things I've noticed again that both you, Laquita, and Arthur have made reference to, the economic challenges that exist here, and not just looking at this from the standpoint of what can we do to help that individual, but what can we do to help that individual's community, i.e. more effectively impact the conditions of their environment. Early in our discussion, Laquita, you talked about your experience in graduating from Spelman, and there were individuals who were gifted houses in the cities that they were going to be moving into. And Art made reference to some of the work that he's doing in the Baltimore and state of Maryland area, where they're trying to look at really connecting the dots and that holistic approach to, again, not just seeing what we can do from the standpoint of addressing the wound physical wound within the patient, but what we can do to address the wounds around that patient that are creating the challenge. I share that with you as a kind of preface because, one of the things that come to mind for me is the economic empowerment piece of this. There's crime throughout the United States, and Lord knows Baltimore in recent years has had its share of crime, community violence. And, one of the realities that we have to face, and I believe more and more folks are really digging into this, is the correlation between poverty and community violence. It just so happens that poverty and community violence are very much under that umbrella of social determinants of health. And, getting back to Laquita's example, there's individuals who are blessed to live in a household where they are inherently and organically picking up on the knowledge that they need to thrive in this world, from the standpoint of, having a banking account to watching your credit and making sure that that's on point, and how to start a business and to sustain that business. And then also there are times where they are more often than not realize the benefits of their family's wealth, and they get that extra little assistance, if you would. That's not happening in Black and brown communities. There's a lot of work being done from the standpoint of our Black chambers and other organizations that are building brick and mortar structures where folks can come in and meet, or they're going to existing structures where folks can meet and they can talk about entrepreneurship and talk about advancing an individual's ability to really manage their finance. But we have to start looking at this from the lens of, or through the lens of, how can we scale this kind of work? How can we begin to impact the lives of more individuals? Because again, typically individuals in our Black and brown communities, again, where we have the highest prevalence for demand and for social determinants of health to be addressed, typically within these communities and the families, which are typically fractured single parent homes, there are no conversations about financial literacy. There are no conversations about, here's what a business is, here's how it works, here's how we make it work for you. And that's why we're faced within the United States with the crisis. I look at it as a socioeconomic moral crisis, wherein over 80% of the businesses are white owned, approximately 14.5 to 15% Hispanic owned, 2.4 to 2.5% Black owned, and then the rest are dispersed among the rest of our diverse population. And then that's compounded by the fact that within the first 18 months of their existence, approximately 80% of Black-owned businesses will fail. This is what the data is saying. And this is not the result of an individual who happens to be Black or brown not wanting to be successful, not having a great idea, not being bright enough, not being willing to work hard enough. They have, want, and are doing all of those things. But what they do not have is equitable access to the knowledge, tools, resources, and support they need to grow a business that will not only make a difference in their lives individually, but can begin to transform the communities within which they live. And they can begin to hire individuals within that community. And this is a real challenge. And I share this with you because, again, I've been inspired by what you, Arthur, and Laquita have talked about, but I can't ignore that economic connection and that economic empowerment connection. And unless we're doing more about that and doing more in that way, then these challenges that we are working so hard to overcome, the housing, the transportation, the food, they're just going to perpetuate on and on and on. So ultimately, it's a matter of empowering individuals and empowering communities. And we can't do this in bits and pieces, 50 people here in this room, 10 people here in this room, 1 or 2 in this room. Very important, it's a start. But we have to start looking at this more through the lens of scaling and leveraging technology to make this happen. I know that's a lot to chew on, but I'd be curious to know your perspectives on that that connection when we talk about connecting the dots and in those areas that you all are focused on. Laquita, if you'd like to start maybe sharing, I noticed you were taking
Too
notes there.
much. Listen, it is not too much. It is the master plan, John, because I can't show up to neighborhoods and be like, hey, I know these unhoused folks. I want to put some micro shelters in your backyard. Let's do it. People are not with that. But what they will accept is, what if we did community Wi-Fi? What if we created an urban garden? What if we found out how to put some electric charging stations in here to get some money for, flowing, whether it's for vehicles, whether it's for scooters or your cell phone even. But bringing these resources, these internet of things resources, tying in the Wi-Fi, teaching people how to maintain the equipment, install the routers, creating community Wi-Fi for communities that will create jobs, that'll create access, start teaching people new tools, because we can't just give them Wi-Fi and throw instruments at them. Like, there needs to be some sort of training, some sort of handoff. We need to know not to, click on the phishing sites and all of those things. But to your point, John, like, it has to be holistic. So one of the things you said is scalability. When I think about this, we start with the community conversation. What assets are you missing, and who in the community can point us to the other resources? And then how do we pull those resources and start to address those needs? So the scalability aspect, though, is just understanding that each community is separate. Each community is different, but we have to start with the conversation of addressing the needs that the community sees, not the needs that we think that the community needs. Because often we speak to, I'm in the development world, and they're like, oh, there's no bank there. We're just going to open up a bank. We're going to drop a Bank of America there. But if you ask me, Bank of America and Wells Fargo are very predatory. Like, if we're going to pick a bank, it needs to be a credit union or a CDFI. But thinking about those things in a holistic way, because we don't want predators in our communities. And me personally, I don't want to concentrate poverty. So I'm also not dropping anything off in the hood that the hood doesn't want. If I get it my way, we put in these tiny homes in Canton, and there will be for unhoused people, okay? Because we're spreading this among the white L. Like, it needs to be some sort of equitable distribution of all of these resources, right? And so another thing that you said is the investment of it all. When I think about the intergenerational healthy housing, the whiteness of it all is that there's power in the pen. And that comes from not letting Negroes read or learn to write. It's all from back in the day, and it's just been perpetuated. So we have to learn how to turn our side hustles into business plans. And that's something that we walk through, because we're going to do it one way or another. So whether we got that EIN or not, we're making the plates, we're selling the dinners, and the bills are going to get paid one way or another. But if we can figure out a way to leverage it and make the relationships with even the predatory banks to get the loan for you to use the commercial kitchen, or to buy and invest in better quality, tools or utility, whatever that may look like, is how we make it scalable. Is we understand that each community is different, and we're operating in a capitalistic society. I don't want to participate in it, but if I don't, I'm gonna be one of the unhoused people. So I have to participate in it, and I have to conform to some of the things that I consider whiteness. But it is our culture. It's the way society is. And we have to operate in the society that exists, not the ones that we see in our heads. Even though in my mind, I'm doing all the stuff that's in my head, y'all. But outward in the world, like, that takes agency, that takes gut, that takes some boldness. And not everybody has that. And I don't expect everybody to have it, right? And then I'll finish the last thing. It's the power of, like, the talented 10. we're educating ourselves, and we got to reach back and pull people up and understand that not everybody can come right now, and not everybody will end up coming, because this ain't for everybody. But we have to include the people that are willing to be involved, that want to be included, and that have some sort of vision, because if we don't nurture those things, it'll fizzle out. And I can't do this much longer, y'all. So
Mm.
I'm gonna go on mute. I'm gonna go on mute.
Well said. Art, what about yourself when you think about, the scalability and needing to scale, to get these resources in the hands of not just, a few, but many within the Black and Brown community? What are your thoughts there, Art?
It's hard to hard to follow that, but try to be as intelligent as possible. I think from what I know, as far as my thought of scaling, is that, like you said, John Matthew earlier, a lot of times you see projects and they're doing like, you know, 50 people here, doing 10 people here, 100 people here, and that's cute and all, that's great. But to address the issue, we really got to look at things systematically and really focus on things that can scale, and really, like, not try to hide from the fact that we live in a capitalist society. Like, for example, most physicians, they're great people, but they also have money that they have to make money, right? They have to pay staff, they have to take care of what they have to do for their small business. I think we have to just get away from demonizing physicians and figure out how to work with them and work with the current system and move forward in a positive direction. And I think the social determinants of health and value-based care has created sort of a roadmap to help onboard that transition. What I think we need to do is help it scale by, being very creative, really pulling people together and trying to work on projects that really move the needle, that really are from the get-go meant to be scaled, not to be token stuff or things that, that just looks good. Give a kid a shoe here, give a kid a backpack here. And that's great. I'm not saying we shouldn't stop doing that, but let's look at a system of saying, can we solve this problem? We have a $70 billion diabetic, actually $140 billion diabetic limb problem in the US. That's a big number. How can we solve for that problem? How can we solve that problem? And then at the same time, make sure that the powers that be, we don't just gut the economic system of people who make money off that per se, but do it in a way where it's solvable, but we kind of transition it to a more positive, situation, right? Where we reduce costs and we also help the people who care for these people to be taken care of financially in the new system of moving forward. Like Keita said, we live in a capitalist society and people have to pay the bills and they have to do things, and it's hard for a person to concentrate on taking care of you when they're not taking care of their kid next to them. So just think about it really practically from that standpoint, being very thoughtful on that, I would say.
No, that's great. I appreciate that, Art. That's really profound, and I think you followed Laquita excellently with that point. I just recently read that the Biden and Harris administration are going to be, providing some funding nationwide, whereby individuals, cities will be in a position to really move the needle as it pertains to the digital divide. So I think that's going to do wonders in terms of assisting with some of the things that we need to see occurring. I'm seeing there's a hand raised for a question, and again, I wanted to leave some opportunity and time for that. I don't know if the hand went down or not, but I wanted to make sure that we were tapping into those questions. But before I do, I just wanted to just raise a couple of more points. There's this saying that teach a man to fish and you'll never have to teach him to fish again, or hunt, whatever the case might be. But, there's a huge difference between teaching someone how to fish and how to hunt and not allowing him or her access into the depths of the ocean and the deepest forest where the opportunities, can be captured. You can catch the fish and you can hunt and come back and have what you need. There's a huge difference. And I think that's something that we need to realize and really start leaning into. Yes, it sounds good, but again, I don't like being that individual, because I am a capitalist, but I'm a socially responsible capitalist. And I believe that there's enough for all of us. I don't want to be that individual that's been given all these wonderful tools, but I can't do anything with them. So I think we need to be more intentional about that. And not just we here on this call, but just society as a whole, which leads me to one additional point I wanted to make. I think that I believe very strongly that the idea of placing the burden of addressing social determinants of health on our healthcare systems, it's too much. When you look at the very definition of social determinants of health, and you look at the employment aspects of it, and the aspects of income, there are opportunities that employers have to create transformation and to be a part of this social determinants of health journey. And it's a missed opportunity in a huge way. And I would say as well, even at the level of government, there's opportunities for them to be more intentional about their contributions into this space and to create collaborations that exist between, private industries and our hospitals and health systems and government, where they can arguably create an alliance within the respective geographies they're in, and not look at what they could do individually, but collectively to make a difference. I think that's a conversation that needs to take place. But with that said, it's 7:04, and we've been on for approximately an hour having a conversation. I wanted to take the opportunity to look at some of the questions that might be out there. I'm not sure. Let's see. Looking. Okay. Not seeing any questions thus far. But again, I'd like to encourage folks, to put your questions into the chat box, and we'll happily engage those as we continue the conversation. In the area of looking at this as more of a collective or an alliance, there's another opportunity I'd like to talk about, Arthur, and I know you, Laquita, have done your share of mentoring. And mentoring, it serves an invaluable role as it pertains to addressing the neglected area of social determinants of health, i.e. education, and the opportunity to begin to more positively impact the lives of our youth so that they are better positioned for their future, less likely to make those bad choices in the heat of the moment that completely change and or destroy their lives. I'm curious to know, Laquita, your thoughts on the role potentially that mentoring could play as it pertains to empowering our youth so that they can, as you say, have agency over, their health and their well-being, et cetera.
Yeah, for me, mentorship is absolutely necessary. And sometimes, I know when people first start looking for a mentor, it's like your mentor has to acknowledge you and you have to make an agreement. And sometimes I think we can just learn from being around people and taking experiences from conversations and paying attention. But more importantly, like that one-on-one and being able to let someone know that you don't know what you don't know. And so you don't know what questions to ask. So for me, I'm like, give me all the information and then let me sift through what I want to dig into. While some people don't even know where to start. And so having a mentor, I think, allows us to begin the conversation or at least get a head up or an idea of which way to go or which way to navigate. Mentors are really helpful with resources. And for me, now that I'm out of the IT world and decided corporate America ain't for me, honey, I am a professional fellow. So I have been a Johns Hopkins Public Health Equity Fellow. I've been an OpenWorks Makers Fellow. I've been a fellow for Capital Impact Partners and developers in the DMV. Like, I want all the information because information is power. And I'll take that information and boil it up and use it in Baltimore homes the best way possible. And continue to dig into those mentors because those mentors have relationships with people with money. And in this capitalistic society, we need money. They have people that will open doors to foundations or grants or even just having a conversation with somebody to pick their brain. So mentorship is absolutely definitely important. And by the way, shameless plug, the Hopkins Bunting Fellowship is opening up in October. I am a former Bunting, well, I guess I'm an alumni. I'm not a former anything. I'm a Bunting alumni. It's a health equity fellowship where Hopkins just takes 10 months to pour into you and really try to make your social innovation idea connect with the Hopkins community, because they need to do that and so much more. But still, it's just necessary, right? Like having that understanding how you can work with those bigger institutions. And then one other shameless plug, walk with the doc. We do a wellness walk at Lake Montebello with doctors who are from, your Kaiser Permanente, your Hopkins, they're right here in Baltimore. But we do that because doctors don't have that positive, that positive idea, that positive role model in all situations. And so this way you can meet them in a more private kind of, not private, but communal kind of setting, and people can ask questions. And more often than not, people whisper the questions in my ear and I ask them to the doctor, and we're okay with that because this is a safe space, right? Like it's all about sharing the information and making sure that people are comfortable with asking questions about the mole on the bottom of their foot that they're afraid to show somebody. Take a picture of it. Let's show it to somebody. Somebody needs to know that this is something that's giving you angst. And so for just because of that is more than enough reason for us to bring it up in conversation. So the mentorship is necessary, partnering with the hospitals. I like it. I love it. But show up at Lake Montebello, walk with the doc, 10 a.m. Sundays, first and third Sundays, but pull up with us so that we can engage a little more. And then you can meet some doctors. We have chiropractors, mental health specialists, but the idea is to bring them into the community because there's so much disconnect. And it was really helpful during COVID when people stopped going to the doctor. So
Wow.
bridging the gap, just meeting folks where they're at.
I think that's brilliant. And again, getting back to, our conversation about building trust between clinicians and patients, so that we can, make that good health and wellness and well-being thing happen. I wanted to pose the same question to you, Arthur, but also wanted to be very respectful of folks putting questions out, and there are a couple. And I'll leave this for us to answer collectively. One of the questions reads, what would you say about a business serving Black people in tackling poverty and providing resources? Your thoughts on how can this be done? And then there's a similar question surrounding, or statement surrounding, Black businesses serving only Black people.
Mhm.
Interesting.
Mhm. Listen, look, I'm gonna tell you, I'm all for it. I'm all for it. It makes some people uncomfortable, Black businesses only serving Black people. But I'll say it all the time. Everything that I do, I have Black women in mind first, because the misogynoir, the patriarchy, the racism of it all, like it's multiply compounded. People don't understand it. And if Black women feel welcome, then Black men will probably feel welcome, and white women and other men and other women. But as long as we feel welcome like that, I'm all for it. But to answer your question, Black people tackling poverty and providing resources, it's right. We have to address the trauma, because that's not something that a white organized institution is likely to address. So we're going to have conversations about trauma and conversations about different things that just give people agency to continue to understand it's a safe space. But tackling poverty, I really believe that we have to learn to partner up, delve into the grants or the donations or the foundations of it all. It's still institutionalized, but it's a part of the cog. It's a part of the whole system, right? And so those foundations have to give away that money. It's only 5% of whatever their whole endowment is, but that's besides the point. That's not what we're worried about. What we're worried about is continuing to build those relationships and show that we're working together. So if those Black organizations are partnering up, those foundations are likely to provide money. You can speak to it in the terms of the social determinants of health and addressing trauma and addressing housing and education and whatever. We also host a community conversation the last Wednesday of every month to have these conversations so that you have the language that's needed to get the money because you're going to do the work anyway. You're probably doing the work now for no money. So at least pair up with somebody, put a proposal together, send it to Abel, Annie Casey, the Weinbergs, whomever, I don't know, but we'll figure it out because they're funding something because they know harm has been done. So Black people tackling Black problems, I'm with it. But we also have to be cognizant, like Black folks don't love mental health. We don't love talking about it. We love to say that somebody's crazy, but we need the mental health work. Like racism is real. Children recognize it. It impacts the way that we think about ourselves, the way we see ourselves. I'm older than I look, and I am so grateful that Lauryn Hill and Moesha and all these brown women were so popular in the 90s. And I never had that thing that was like, I should be lighter, but that is a whole, colorism is a thing, y'all. Like it's what representation matters, having these conversations matter, and just trying to meet people where they're at, and just knowing that we can't fix everything, but we can help people, and just be empathetic in that.
Absolutely. Art, I'd be curious to know your thoughts. I know we talked a little bit about the mentoring and then the question, as it was posed, in terms of the role that Black people can play essentially on, being a part of correcting things in their health, et cetera. What are your thoughts?
Yeah, I mean, I think we, I think, one thing is that, we really need to take control of our communities in a way, as far as Black businesses and Black.
You're muted, Art.
I had a call that came in and cut me off. I'm sorry. So I think we need to take control of our communities, and Black businesses, women-owned businesses need to have a front role in, like, controlling what happens in our community. And I just think a one big thing I can add is that the strong economic piece that we talked about earlier, I think it really lies around mixture of entrepreneurship, and just understanding how we own and control either the message and or the vehicle that aligns to what we're doing. I think it's very important that we need to think about those things and not give it that away, give up control, give up like influence over things that affect you. Like you wouldn't do that with your kid or your child. And I don't think we should do that with our community. And I think we do that a lot and give away our power. But yeah.
Okay, great. There was a question regarding the name of the Johns Hopkins Fellowship opportunity. Laquita, if you could maybe answer that in the group, that would be great. I have some thoughts, and I'm going to be transparent here. To really go down, this path, I have to, say that I do have a client I'm consulting with, The Lonely Entrepreneur, a very interesting platform. The founder, who happens to be white, gentleman that is from New York City, very successful as an entrepreneur, but recognized, in the wake of George Floyd incident, that we had an opportunity in front of us to do something as it pertains to social injustice and addressing it sooner rather than later. So he created a platform called The Lonely Entrepreneur. And The Lonely Entrepreneur, within its platform, there is the learning community, and then there's also the Black and Hispanic Entrepreneur Initiative. And this is essentially a one-stop shop location that provides the knowledge, tools, resourcing, coaching, mentoring, access to financing, over 200 resources in that realm, over 1,000 learning modules, all of this information located in one location where individuals can essentially begin to take ownership of their empowerment as an entrepreneur, literally from that individual who is having entrepreneurship as a gleam in their eye, not knowing quite what they want, but they know they want it, up to that individual who is ready for Series A funding. And so I share this with you because, when we talk about, the empowerment piece of it, and we talk about the scaling and the need to scale and utilize technology so that we're not leaving anyone behind, this is one of those resources that can do that. It's interesting, the founder, I've had conversations with him, and he would always say, I don't understand why this has not been created. Why has no one else done this? Again, going beyond, not to take away from the brick and mortar structures in our community, but to enhance them, to scale them, to bring what they're doing out and into the community, but in a bigger way, so that it's not just 50 people here, 10 people here, 15 people there that are gaining the knowledge that they need about entrepreneurship, but a vast community. And with that vast community having access to entrepreneurship tools and resources and skills, now they are empowered, not only in the area of potentially becoming an entrepreneur, but also on the job. They are now able to learn skill sets that you don't necessarily need to go to college to learn. They can just pick up their phone and they can be tutored through these things or coached through these things. There are coaches that actually do this. And, they're in a better position in having this as opposed to not. And our communities are in a better position in having this scalable resources versus not. And it's not something, again, where we're saying there's just a select few, but hey, let's just open this up so whoever wants to excel can excel. So it's an incredible platform. But when we think about, how can we begin to empower Black communities, we have to start looking at solutions like these. Solutions that, again, are scalable, impactful. We can track impact over time. We know where they began. We can watch them grow. We can identify along their journey if they're not moving the needle, proactively ask why, and what resources additional would they like to see. It's possible they may have overlooked a resource that's there. And then the other piece too that's very interesting, we talk about opportunities to mentor. The platform is unique in that there's the ability for businesses within a geography. Think of any business in your geography, no matter how small, no matter how large, they have the opportunity to volunteer their time and their expertise and begin to mentor specifically within the region that they're working within at scale. Those are some of the things we need to do. But because the question was posed, I thought I'd be remiss in not, sharing that opportunity because it's huge. I mean, they're currently serving over 100,000 entrepreneurs across the country with ambitions to serve 1 million. And so just imagine what that impact would be, not only for individuals, but, for the community. So I'll rest on that there, but we're really, really excited about it. And it looks like there's an incredible opportunity also at Morgan State, EDAC as well. So again, the opportunities are out there. We just have to shine a light, do a better job at shining a light on them. And I think just being amenable to conversation, and stop guarding everything so close to the chest. I take it back to something Dr. King had said, where he would say, each of us, and I'm paraphrasing, are inextricably connected. What happens to one indirectly and directly impacts another. So we have to stop guarding and start opening doors and letting folks in, and not going this way by ourselves. So I'm going to pause on that. This has just been an incredible conversation. We talked about this ahead of schedule, in full transparency, and this is what we wanted. We wanted to have a conversation. Hopefully, we've shared something with you all who are listening this evening, something that may have provoked a thought, an idea, inspired you to take action. But whatever the case may be, we encourage you to do that, take action and be a part of the change that has to occur. As Laquita says so eloquently, take agency. and be a part of it. Art, Laquita, is there any additional thought that you would like to share? I want to make sure that, when we leave this call this evening, we leave on empty if it's possible, so that we've, shared with everyone what they need and thoughts that you may be having.
Yeah, I'm going to type this stuff in the chat afterward, but I wanted to just say it again. Someone asked a question about the Johns Hopkins Fellowship name. The fellowship is the Bunting Neighborhood Leadership Program, BNLP. I'll put the website in the Q&A because it doesn't look like you can see my chat. Like you mentioned, John, the Morgan EDAC Center, and as well as an organization called Innovation Works. They are a free service, but they help entrepreneurs but visualize their social innovation, right? And so that is what we need to tap into to pull the funds out of the people. What makes us unique? How are we tapping into social innovation or, addressing needs and equities? And then finally, Walk with the Doc. I'm typing it now, but it's at Lake Montebello. It is first and third Sundays at 10 a.m. It is free 99, and we provide a light breakfast. We do some movement and mindfulness, and that's with the collective Project Healthy Communities. And I'm just happy to be a part of this conversation. We're doing the Health Equity Summit in November, but up until then, we'll continue to engage folks. I'm just looking for people to partner with and bring these tiny home villages. I know it's going to take years, but starting the conversation now as to what communities need and what people want to tap into, I'm all about it. So reach out to me, smalltomorehomes.org, spelled like it sounds. It's up there. I'll put it in the chat, all the things. See you, love you, bye.
Art, and yourself, were there any parting thoughts that you have? Perhaps?
For me, I would just say, let's connect the dots and let's collaborate. I think that's what I would say on my end. Is the thought is that let's collaborate and let's work together. Let's not hide things from each other. Let's work on the clinical side, the social impact side, the community-based side, and let's work on solving these problems together.
Excellent. And for my final thoughts, I echo your final thoughts and yours, Laquita. I agree wholeheartedly. The only thing that I would add is that, technology is on our front door. We have artificial intelligence technology, virtual reality, the metaverse, and it can play a profound role in closing the gaps in many of the areas that we've talked about. And I share this as a final thought because just technology in general, it is imperative that within the Black and Brown communities of America, that we do not leave anyone behind. And if we are not informing individuals, as Laquita shared earlier, about technology and the role that it can play in their lives, notwithstanding the role that technology can play as it pertains to transforming community, public health, public safety, these things are happening. And it's up to us to own it and make it happen and make sure that Black and Brown communities are not left behind, in this pivotal period in America. So those are my parting thoughts. And again, it's been such an honor to be a part of this and to have conversations with you all. And I look forward to the continued collaboration in the future. Thank you. And thank you, Ron. I see you there.
Yeah. Well, I just want to close out and just say thank the three of you for sharing your insights, insightfulness this evening. The goal is to continue to share out and to elevate the consciousness around what it takes to really build a equitable health system and equitable pathways to health equity. And so we're having this conversation on November the 9th at our Black Health Equity Summit. You can contact us. You can get more information on our website at www.ndccnetwork.org. There is a website devoted to promoting this equity summit. We have some wonderful speakers. Several of the people here this evening are speaking, and I'm excited just about the fact of entering into this space of really sharing the pathways for equitable processes that can really bring equity, health equity into our communities. So, John, Laquita, and Arthur, I thank the three of you for sharing your thoughts and your insights this evening.
Thank you, Ron. It's a pleasure.
Thank you. Thank you.
I appreciate the opportunity.
All right. Well, thank you. I guess we can sign off.
Good night,
Thank
everyone.
you.